We are back with Brooke Hamby, Public Health Nursing Supervisor for School Health at the Forsyth County Department of Health. We're talking about vaccines and just your overall general kind of good health kind of questions. So we want to make sure that we get your question answered. 336-379-5775. This is an interesting question. This person said, do the teachers have to have all these shots and vaccines as well?
So the teachers are not required to have additional vaccines to come to work, but typically whatever vaccines were required at the age when they were in school are sufficient for coming to work. I know that they do usually make sure that a teacher is at least immune to varicella or the chickenpox and that kind of thing. But no, they don't have to have additional vaccines, but they had what was offered when they were growing up.
Gotcha. All right, so let's talk about the price of vaccines and how the health department can help with that.
So vaccines are very expensive. There is a state program that provides vaccines for kids that are Medicaid recipients or do not have insurance, but the health department traditionally has not been able to accept any private insurances, but they're changing that in Forsyth County. And now accepting Aetna and Cigna insurances for vaccines and other health services that are offered in the health department, which is pretty big. And they're also working on getting some contracts with other insurance providers as well. For instance, a meningococcal vaccine that's required for 7th and 12th grade, out-of-pocket cost is about $160.
Wow. Okay. Yeah. All right. So you mentioned chickenpox, and that is definitely, a kid's thing. When once it goes around, everybody's itching and scratching. If for some reason you think that your kid has been exposed, what should you do?
If you think your kid has been exposed to the chickenpox, you should definitely call their pediatrician and see if they have any recommendations. You can always reach out to the health department and ask the communicable disease department if there are any recommendations for what you should do if exposed. Typically, if a kid tests positive for the chickenpox, we are notified because that is a reportable disease in North Carolina or illness. And once that investigation takes place, our communicable disease team works with the school health nurses and the school system to notify students that are maybe at increased risk or have been really closely exposed to that person with chickenpox, and they'll let them know what's recommended from there.
Okay. You also mentioned that, of course, there's an uptick in COVID. We're seeing that really all over the state and all over the nation as well. What is the protocol for students and also for, just the rest of us going to work?
So the protocol really has shifted from being COVID specific to just being a general respiratory virus protocol. And that's been put out by the CDC. And so what the recommendation is if you have a fever or feel just really bad and your respiratory symptoms are pretty severe, you should stay home. If once you are fever free for 24 hours without using any of that medicine, though, you can go back into public, into school, into work. But the recommendation would be to wear a mask for 5 days. It's not going to be enforced to wear a mask for 5 days, but it is the recommendation. And of course, to kind of keep yourself from getting sick, wash your hands, cover your cough, cough into your elbow, and just make sure you keep your hands washed and sanitized at all times, especially after using bathrooms and touching commonly touch surfaces like doorknobs.
So when you watch people, especially in a public area, wash their hands, a lot of times you either have one, I either think I see one extreme or the other, one of which is someone is standing there for a really long time, and then the other one, they put their hands underneath the water and then they take it back out. So not that we need to tell people how to do it, but let's tell people how to do it.
So to wash your hands appropriately, you should put your hands into the water, put soap on them, remove your hands from the water and scrub your hands for about 20 seconds. If you sing the ABC song, that's about as long as you need to scrub your hands. Then you should rinse your hands under the water, then get paper towel, dry your hands, and turn off the faucet with the paper towel. Dispose of the paper towel and exit the restroom.
Yeah, it is the friction with the soap, right, for that amount of time that really cleans your hands. Not just the soap, but the friction too.